Members will be joining with time, okay? Okay, so let me share my screen. Is my screen visible to all of you? We have 10 members right now, okay? Let me read the comments first. Okay. Guys, before starting the first session, please let me know how many of you are beginners in Meta and how many have experience. Beginners, okay? Asad have some experience, okay? Asad, have you worked through any Meta project? Okay, perfect. That's really good. Right, so since most of you are beginners, so I'll be starting with the research basics. First of all, what is research? Research, in its simplest form, is a process of carefully studying something to discover or create new knowledge. We all know this, like, it's something, discovering something new is research. It involves investigating a topic or idea to find information, analyze it, and draw a conclusion. In simple form, this is what we call research, right? So now there are different type of researches. First, I'll cover some of the basic concepts through these PPTs, and then we'll move on towards the practical work, okay? Um, there are different types of researches, and like there are a lot different ways to classify the research. But okay, one of the way of classification of research is this thing, and we call it this as a triangle of research and epidemiology flow diagram too. Okay, so we'll be starting from this base of the triangle, and as we move up, the research become complicated and it provide quality of information, right? So first type of research is, we'll start from here. Basic information or expert's opinion. In other words, we call it letter to the editor. In expert's opinion or letter to the editor, we give some sort of information to the editor or some news to the editor. It may be like a 400 words or 200 words paragraph. Now there are two types of letter to the editor. In one type of letter to the editor, we basically critique an article. For example, if we have an RCT or any article that is published, let's say yesterday, I came through that article and like I found some mistakes in that article, like maybe some technical issues, maybe some ethical issues. So I do criticism on that article. I'll write a letter to the editor. Um, Again, I'd say maybe 300 words, 400 words, depends on the journal criteria. And I'd point out that issues to the editor, that like in this article, here is the issue, and we'll give reference of another article, that another article is conducting on the same topic, but there is no issue in that article. So this is what we call a critique letter to the editor. Now, another form of letter to the editor is informative LT. In informative LT, we basically give any recent information to the journal or to the editor. For example, let's say if any drug is approved by FDA, for example, a new drug is approved for diabetes today, so I'll write letter to the editor on that drug, giving the basics of that drug, and I'll tell the editor that this drug is approved and like this drug will come into market soon. So like, a short information I am giving. Or for example, there is a outbreak of a disease or any endemic or any epidemic. For example, today I wrote a letter to the editor on dengue in Bangladesh. These days there's a breakout of dengue in Bangladesh, so I write letter to the editor to Lancet Journal. In the same way, last year in September 2024, there was mpox breakout in Pakistan. You all may know this. So we have letters published on that thing too. So this is basically letter to the editor. Now come towards this case series and case reports. Case series and case reports are short things in which we give, like, if a real case, sorry, a rare case we encounter, so we give information to, we can't say information to the editor, but like we write a short paper on this. So this is called case report. Any rare disease we encounter, or any rare, yeah, we can say rare disease we encounter, so we write case report on this. Case series is if like there is more than one cases on the same thing, like, for example, if we encounter one such case, we write case report. Case series is if we encounter 5 6 cases, so we write case series. Then comes the case control and the cohort studies, and in between here it comes the cross-sectional studies. In case controls and case series, we write something about like drugs or diseases. In case control studies, we try to find out like the disease is there, a particular disease is there, and we are trying to find out the risk factor of a disease, right? In cohort studies, basically, we have the risk factor and we are trying to find out the disease from that particular risk. So this is about case control and case series. Then comes the randomized control trials. Randomized control trials, like a high evidence of studies and like high quality of studies. And in randomized control trials, for example, we may be testing some drugs, or those who are from third year or like above third year, they may know about like randomized control trials, that we test drugs through it or different therapies through these trials. Trials can be of two types. They may be randomized control trials or maybe non-randomized control trials. These details I'll tell you in the data extraction or the in quality assessment thing. But here, randomized control trial are like the highest evidence research. Then comes the systematic review and meta-analysis. We'll be having a mentorship program on these two types of researches. So now comes towards that what is systematic review and meta-analysis. First, in like simple words, I'll tell you, for example, I have a drug metformin. Now, there may be hundreds and thousands of researches on metformin. There may be some case control studies, there may be some cohort studies, or maybe some RCTs. In one RCT, they are saying, for example, I'm studying metformin for diabetic control. Metformin is an hypoglycemic drug. So, for example, in one study, they may be saying that metformin decreases the glycemic percentage by, let's say, 5%. Study, they may be saying that metformin decreases the diabetic, let's be saying that metformin causes, let's say, skin rash, but in other studies, it may be written that metformin doesn't cause skin rash. Now, what are the cumulative results? What the practical guidelines shall follow? So, in order to like pool all the studies and give cumulative results to the community, we perform systematic reviews and meta-analysis. For example, if I'm doing meta-analysis on this metformin in diabetes patients, type 2 diabetes patients, so I'll be compiling all the studies like according to my choice. If I'm doing meta-analysis on RCT, so I'll be compiling all the randomized control trials, then I'll do meta on those trials, and then I'll see what are the final results from those RCTs, right? I'll like analyze the results of those RCTs. So this is the main function of systematic reviews and meta-analysis. So what's written here? Meta-analysis is a quantitative method that pools data from several related researches, often randomized controlled trials, to assess overall effect of a particular intervention or exposure. As I said before, to assess the overall effect. Like, we can't rely on one or two studies. If one study is saying that metformin is good for diabetes, and other studies saying metformin isn't good for diabetes. Let's say an RCT is conducted in China and it's saying that metformin is good for diabetes. So Chinese people are like using metformin. Another study is conducted in Pakistan, and the results of Pakistani studies are that metformin isn't like decreasing the glycemic percentage by that much, and like it's having several adverse effects. So we may not be using metformin. So it's not like this. The practical guidelines follow the results of meta-analysis and systematic reviews and meta-analysis. For example, if I have pooled 100 RCTs on this particular. I'll be telling you about the intervention and exposure thing later. But if I compiled 100 RCTs, so the practical guidelines will follow the results, the cumulative results of those 100 RCTs. So that's simply about the systematic reviews and meta-analysis. Now we can do meta-analysis of RCTs like trials, and we can do meta-analysis of observational studies. Okay, one thing I forgot in this. Basically, all these studies, from the case reports, the case control studies, the cross-sectional studies, you may all know what are cross-sectional studies. And the cohort studies, these all studies come under the category of observational studies. Then comes the trials. Trials can be of two types: randomized control trials and non-randomized control trials. Later I'll explain what are randomized and non-randomized, but like we have two types of meta-analysis of RCTs and meta-analysis of observational studies, and there can be mixed metas. Like the one you people will be doing with me are mixed metas. Like we'll be having cohort studies in these metas too, along with RCTs, right? Now, coming toward the one of the most important rule in perform the meta-analysis. In meta-analysis, we have to understand what is PICOS. So basically, as I told before, we perform metas on certain drugs or certain therapies or certain diseases. So if and like most of the metas on or are on drugs or like surgical interventions. Let's say, so if I'm performing meta on a drug, there may be a drug, sorry, there is a drug in the meta. There would be some sort of patient population. Along that, we would be having a control group. I'll be explaining what is the control group, and then we'll be having some outcomes from those drugs, and then the study designs. So first of all, the P in PICOS mean population. Population means which type of patients we are assessing, like what disease we are studying. So patients with a condition of interest is our population in a meta. The next thing is intervention. The new or non-traditional method being tested. The drug or the therapy we are testing is intervention, right? Then C stands for comparison. Comparison means the traditional or the standard methods used in practices is our comparison. Then O means outcomes, like the clinical effects or the results my yields are the outcomes. Um, Maybe this thing is overwhelming for right now, but you will understand this at the end of this the lecture, right? Then S means study design. Like as I told before that we can do meta on RCTs and we can do on observational studies. So before you are conducting a meta, you have to set your PICO. What is your PICO? Now, I'm sorry, I just did it. Okay, now let's understand this through an example. Let's say I'm performing a meta on to know the efficacy and safety of metformin in gestational diabetes. So, what is my patient population? My patient population is patients with gestational diabetes, right? Here, the P would be gestational diabetes. What is my intervention? And my intervention is the drug, my drug of interest. I'm studying metformin here, so my intervention is metformin. Now, what is C? Sorry, control. I'm studying here is placebo. I'll show a study on this example to you people. Okay, so placebo. Now, what is placebo? Can anyone answer me what is placebo? Um, Anyone please open up your mics and let me know what is placebo, if anyone is having idea.
Ma'am, placebo is something that you give, but it doesn't cause any effect as that of any kind of drug. I mean, it's just a substitute for a drug, but it doesn't cause any effect.
Okay, yes, exactly. So this is called placebo. For example, placebo is something in the shape or in the form of drug, but it won't contain that particular drug. We are just using placebo for the purpose of researches or for the purpose of like a control arm. Like we know there are two arms. One is experimental arm, and in order to um study the effect of that particular intervention or that particular experiment, we must have a control arm. So like in comparison, we get the results better, right? So this is called placebo. Anything which looks like a drug but doesn't have any effect of a drug, so it is called placebo. For example, in simple words, I may be giving metformin to one gestational diabetes patient, and I may be given a toffee to another gestational diabetes patient, but in the same form as metformin, and the patient might not know that it is not metformin, it is toffee. So this toffee we call placebo, right? Now let's say what are my outcomes. So my outcomes of interest are fasting plasma glucose or fasting glucose level and initiation of insulin, hemoglobin, HbA1c at 38 weeks. This I'll show through example. Now I'll share RCT, and my study design is RCT. Now on this example, I'll come to a study, and in this study, I'll show you my PICO. So this is the study. Okay, focus on the title of the study. My title is Early Metformin and Gestational Diabetes, a randomized control trial. Right? So, what I got from this thing? My intervention is anything, any drug mentioned in the title shall be your intervention. And now I'll tell you like uh, two different types of controls, so you will be cleared more. My intervention is metformin, and my patient population is those with gestational diabetes. And my S means study design is randomized control trials. Now, I can see the objective of this study. This, yeah, to test whether early initiation of metformin reduces insulin initiation or improve fasting hyperglycemia at gestation week 32 or 38. This is the objective of my study. And you can see again from here, it is double-blinded placebo-controlled trial. Okay, so the third thing I got from this, that okay, my intervention is metformin, the patient population are of gestational diabetes, and it is placebo-controlled. Control group is placebo. I can check my PICO directly from here too. Like if you people are, I'll show you how to select topic for meta. So if you people are searching for your PICO, intervention, sorry, the patient population, you can directly read from here, or this short summary of the study, which we call abstract. Use people can study the patient population from here too. Now, in order to directly know what is the intervention and control, you people will come to this flow diagram. These all sections of RCTs will be covered clear to you in the upcoming sections of the in our upcoming sessions, right? So we can see from here that we got 535 pregnancies, like 535 patients with gestational diabetes, and 268 received metformin, and 267 received placebo. So it means my intervention is metformin and my control is placebo. The first therapy is always intervention, and the second one is placebo. You can also judge your intervention and control from table 1. Table 1, I'll explain later that what is table 1, but table 1 is the baseline characteristic table. You people can directly come to the table 1 and you can see what is your intervention and control. So I can see from here, early metformin, intervention, and placebo is my control. So I hope this thing is clear. Moving on again towards our slides. Let me know if you people have any questions till now. Is it clear? Study design thing, PICO thing is clear to you people? If any question, do ask me. It's clear. It's clear to all?
Can you please tell me that table one, which were you showing? I didn't understand that the table one.
Okay, wait. Table 1, I'll explain to you in the quality assessment section, but for now, being just understand one thing from table 1. In order to know what is your intervention and control in the study, you will just go to table 1 And the first therapy in the table 1 shall be your intervention, and the second therapy in your table 1 shall be your control. Got it?
Yes, thank you.
Okay, now, okay, so what are the basic steps of meta-analysis? First of all, in meta-analysis, we have Pygos formation, which I told you before. Like before you are doing meta, you encounter, I'll tell you how to select topic for meta, but once you are selecting topic for meta, the first step is your Pygos formation. You must know what is your patient population, what is your intervention, control, your, it's not important. The outcome things in the first, like once you are deciding the topic, the outcome things is not important in the very first step, right? It will be important in the like in the next steps, but you have to see your patient population, your intervention, your control, and your study design. The next thing, once you like form your PICO, the next thing is literature review. You have to search the literature. Like literature searching in a sense that you have to find, is there any meta done on that particular topic or on that particular PICO? If any meta is done, then your next task is to see, can you update that meta? I'll tell you how to update that meta. In the next slides, I'll move on towards the topic selection. Okay, once you are done with the literature review and like you are confirmed that okay, my topic is viable, the next step is screening. You have to do screening means that like you have to, as I told you before, on if we are doing a meta on particular topic, so we have to collect all studies according to that PICO, and then we have to pool the results of those studies. So we have to screen all articles available on different databases like PubMed, Embase, Scopus, and different databases. According to Cochrane rule, like we have to take articles from at least 3 databases. Now the articles may be in thousands, they may be in hundred. Then we have to screen those articles. We have to select those articles which are exactly according to our PICO, right? Now, once we are done with screening, we'll do the data extraction, we'll do the data analysis, we'll do quality assessment. After quality assessment, we'll do manuscript writing. In manuscript writing, first of all, we write introduction, then we write methods, then we write results, then discussion, and finally, conclusion. Then we'll register this on Prospero and then journal selection. So today we'll be covering the first 3 things. We have covered the first thing. Now moving on towards the literature review. Like you have to, before literature review, first of all, how you have to select the topic. Let me know what's the, so now there are 2 ways of like selecting topic for meta. Either you have to search for recent RCT or any recent cohort study. See, I told you that meta can be of 2 types. Either metas of randomized control trials and meta of observational studies. In observational studies, we may have case controls, case series, cross-sectionals, and cohort studies. But rarely people do metas of cross-sectionals and case controls and case series. We mostly do metas either of cohort studies and RCTs. So if you encounter any recent RCT, for example, RCT is published, let's say yesterday on 17 July. That RCT, I came across that RCT. Now I like that topic. I'll search about that topic. I'll search if any other RCTs are present or any other cohort studies are present on the same PICO. If yes, then we can do meta on that topic. So this is the first thing. I'll show this thing practically, but first let hear to me. Either you can select topic by searching for recent studies, maybe like not importantly like recent, I mean the studies of 2025. These studies may be of 2022, 2023, 2024, until and unless meta isn't done on that topic, that study is recent for you. The next method for searching topic for meta-analysis is to look for past metas or like, yeah, old metas. If you like that topic and you want to do meta and on a particular topic, but meta is already done on that topic, then one thing you can do is to update that meta. Now I'll show you how to update a meta, but there are like several rules for to conduct meta analysis. we must have 3 studies to conduct a particular meta-analysis, and these 3 studies must have same PICOs. Not a, yeah, we can see must have same PICOs. The patient population shall exactly be the same. The intervention shall exactly be the same. The control shall be exactly be the same. But now listen to me. Control can be same in case if we have solid controls. There are 2 types of controls. One, we have solid controls. One, we have standard of cares. Like in solid control, let's I came across a study and it's comparing metformin to semaglutide in gestational diabetes patients. Now, metformin is a drug too, and semaglutide drug too. Metformin is intervention, and
There's,
semaglutide is
excuse
yes.
me, there's less than 1 minute left. Please wind up so I can make the new link.
Okay, okay. So guys, we'll be continuing the discussion with a new meeting because the time is less.
Guys, I'll create it in a minute and please join in 2 minutes, please. ज़्यादा late नहीं करना, okay?